Good weekend, everyone, and welcome back to our Monkeypox Weekend Briefing. Today, we're going to discuss the WHO decision on whether monkeypox should be considered a public health emergency of international concern and what constitutes such decision and what it actually means. In addition, we're going to share some data released today regarding cases below the age of 17 and some female cases as well. So let's get started with the WHO major announcement today declaring monkeypox as a public health emergency of international concern, also known as PIC. Now, before we move on, it's important to note that there was a vote within the WHO committee, and 6 voted for that and 6 voted against it. But Dr. Tedros, in a very unprecedented way, overturned that decision today, declaring it as a public emergency. Now, let's talk about what constitutes a discussion whether a virus should be considered as a PIC. So the first bullet point would be data from countries that show a rapid spread of the virus and something in particular that country haven't seen before, and that definitely meets that bullet point because a month ago we had around 3,000 cases, and today we're over 17,000 cases, and this virus spread to over 70 countries. So that bullet point definitely meets that criteria. Then he mentioned 3 other criteria that meets the declaration of a public health emergency of international concern. The third one would be the advice of the emergency committee, which, as we mentioned before, we had 6 voting for it and 8 voting against it. But as you've seen, Dr. Tedros overturned it in a very unprecedented way via conference call today. And the fourth bullet point would be a scientific principle, evidence, and additional relevant information. And Dr. Tedros said that we haven't had sufficient information in that respect. And last but not least, the risk of human health, international spread, and international traffic interference, and that meets the criteria of a PIC. So that's the reason why Dr. Tedros decided today that he's moving forward with declaring monkeypox a public health emergency of an international concern. Whether it's a month late or not, it doesn't matter at this point. At least they got it done, and hopefully now things can be maybe not contained, but things will be more transparent and countries will work together to try and stop this virus from spreading further. Now that we know what constitutes a public health emergency of international concern, let's discuss in short what it really means. So greater global ability to rapidly mobilize international coordination and, most importantly, streamline funding globally and accelerate development of potential vaccines and antivirals under the emergency use of authorization. And this time it's a bit different than COVID because back in 2020, we never had an antiviral for COVID, nor we had a vaccine. And now we have both antivirals and vaccines approved. So this time things are a little bit more organized in terms of where can we get vaccinated if we need to get vaccinated, and what if we catch the virus, where can we get the antivirals. So we have both of these, so that makes things a bit easier in terms of what to do in case we contract the virus. But again, that doesn't mean it's going to work. That doesn't mean it's going to help. I mean, we've seen people get vaccinated for COVID and still get COVID. So let's see how that works out. So now that we know what constitutes a PIC and what it really means, let's go over the history of previous declared public health emergency of international concerns. So the International Health Regulation is the governing body for the global health security since 2007. The WHO declared a PIC only 7 times in the last 15 years, including today's declaration. And lastly, and probably as everybody knows, COVID-19 was the last PIC the WHO declared before their decision today. So maybe it's not as rare as people would think, but still, 15 years, only 6 times, that's pretty rare to me. So this decision today is pretty significant in all respects, and hopefully this decision today will make people, governing bodies, local agencies more aware and will be better able to tackle this virus together. So let's hope that helps in some way, because it's better late than never. Now, to wrap this session up, we wanted to share some new data in monkeypox cases among children and women. So out of 10,000 cases recorded, 72 cases were among children under the age of 17, and more specifically, 24 were under the age of 4. Now, if we use similar data for 17,000 cases, as right now we have 17,000 cases around the world, cases among children should be around 120. Now, we also have 114 female cases, which translates to about 190 female cases if we use the same data across as we used for children cases. Now, if we take this data between children and female, this constitutes of 2% of all cases, which may seem small, but at the same time, if this breakout grows larger, this may spill out further to other demographics, and that 2% can become 4%, 6%, 8%, 10%, 40%. We don't know because it's still too early to tell. So I guess we'll have to find out in the coming months how this data translate and if we actually get a greater spill moving forward. So this was it for today. We hope that this video was informative and that you enjoyed it, and we will see you again next time. And again, thank you very much for joining us, and we hope you liked this video. And if you did, you can subscribe below, hit the like button, and you can also leave a comment. Thank you very much, and we'll see you again.